Dear students, welcome to my class on immunization. Immunization is a word which is developed from immunity. Immunity is a power to refrain infectious diseases to our body. What is immunity? The power which restricts the spread of pathogens in our bloodstream. So, the immunization starts from very beginning of our life, that is from the uterus of our mother. It strengthens the physical capacity to prevent various infectious diseases. Why immunization becomes a need? Because infant mortality rate and maternal mortality rate becomes more in Odisha in our national level and also at international level. So, to keep we all fit and fine in every respect, that is mental ability and physical ability, scientists, educationists, they prepare a very thorough investigations, experiments in laboratories to develop the immunization schedule. Natural immunity, it comes from mother, because our life starts from the uterus of the mother. When a new egg being fertilized placed inside the mother, the blood from the mother provides food for its nourishment to be full grown to a child. So, natural immunity passes from mother to child, but artificially through immunization we develop the preventive power. Why? Because the natural immunity continues for 4 to 6 weeks. It is almost 1.5 months. After that, when the child come out from the uterus of the mother, that child will in contact of polluted air, polluted environment. So, there is every possibility of contamination of communicable diseases. To avoid irregularities, improper feeding, contamination, we have to go through regular daily care in children. From the very beginning, they should be immunized properly prior to their delivery. What does it mean? Prior to their delivery, which is a period of 280 days, 9 months and 10 days. It is inside the mother and having 3 phases. First phase is ovum, second phase is embryo and third phase is fetus. When the fetus stage starts, at 4th month, our nervous system, entire nerves of the child will start functioning, which is fetal sound. The mother can feel, the other can also feel when the fetus revolves around the uterus. At that time, vaccination starts prior to delivery to upkeep the natural immunity of mother till 6 weeks after birth. Let us come to next point, how communicable diseases transmits from one to other. It can be transmitted by two ways. One is the direct transmission, other is indirect transmission. Directly, if the mother will be diseased, the fetus will be diseased. Ultimately, she will deliver a diseased child. From the very beginning, the child will be contaminated and any sorts of crippleness, mental disorder, physical disorder may happen. Second point is indirect transmission. It can be possible through polluted air, water and through 5 F's. What are those? First F stands for food, then finger, then flies, then fishes and fifth one is fomite. Fomite means non-living elements which we are using inside our household. It may be bed, it may be alna, may be chair, may be table, may be clothes, may be utensils. If properly not cleaned, disinfected, then there is every possibility of transmission of disease. Next, come to the point, if when pathogens, virus, bacteria, microorganisms, these elements enter into our body, they used to find a suitable place in our body to reside and multiply into many numbers. They will pass toxins, their toxin to our blood stream, so that our blood will be contaminated and we cannot know. We will know that we are suffering from that disease when symptoms of that disease will come. If rashes will be there, we will feel that we are suffering from measles. If there will be muscle crampness, we will feel that poliomyelitis is there, infantile paralysis. In other words, if there will be skeletal, bony disorder, then fits will be there. That will be the symptom of tetanus. So, when pathogens enter into our body and multiplied into many numbers and symptoms will be seen, that period is known as incubation period. After that we have to suffer. So, when we will know that we are suffering from that disease, immediately steps are there how to refrain others from the disease. We have to have notification. The nearest health center should be intimated to take care of, so that others will not be affected by that disease. Next step is isolation. In the family, immediately we should isolate the baby, the person in a particular room. If there is no provision of separate room, then we must take the help of the nearest hospital. Ambulance is the best service, airtight ambulance by which the air around our household and environment should not be contaminated, as communicable diseases are speedily communicable to others. Next point is quarantine, which is a very common word nowadays. Pandemic corona you must be hearing. For that we are washing, sanitizing, using masks, and quarantine is a best method. So, what is the difference between isolation and quarantine? Isolation for a particular person in a family, but quarantine is a word which is used for a particular area. Where the disease is, the people from that area should not be allowed to go to an area which is free from that disease. Again, the people of a healthy area where there is not spread of that disease, they should not be allowed to enter into a contaminated zone. Next step is education. Education is a process by which we can aware people about communicable diseases and the how we will refrain ourselves from those communicable diseases. You must be finding people, there will be disease, medicines are available, we will contact doctors, we will be free from the diseases, but these diseases are so harmful, there will be very irregularities in our non-voluntary systems, processes, those are circulation of blood, mental processes, kidney functioning and also digestion, absorption and formation of feces in our body. Feces, that does not mean FISHES, feces means urine and stool. Those should be released from our body in time, otherwise we will suffer from constipation. If frequently those will come out our body, we will suffer from diarrhea or dysentery, liquid, minerals, etc., calcium, phosphorus from our bone, all will come out, keeping our bones weak and the muscles weak. So, people should be aware of that through education, public awareness will be there. Next point is disinfection. It is a process by which disinfectants, we can kill the pathogens which are creating diseases in our body by killing them through chemicals. We can kill them by sunning. The diphtheria, Corynebacterium diphtheriae is the virus which creates diphtheria in our neck region. The children cannot swallow food to their body. A white layer will be inside our mouth cavity, first which is known as thrush, viral infection. We must be thinking that properly, perhaps I am not washing the mouth cavity of my child, so it is, but it is not that. If pressure will be given to that area, there will be bleeding, pain will be there. So, while we start feeding the child will be reluctant to take food. The child will cry if there will be bedwetting, will cry if ant biting will be there. If the bed is uncomfortable, she will cry, and if there will be hunger, she will also cry. So, we cannot find the way when to feed the child. So, mothers are used to follow a time schedule. If the child will suffer from any disease or appetite, loss of appetite will be there. Whatever may be, we have to feed the child to provide energy for all her activities, even when the child is in sleeping condition, for resting energy, for continuing her internal non-voluntary processes, we have to feed, otherwise the children will be weaker and it will be easier on the part of the pathogens to enter into the body to create diseases. So, come to the last point, which is not also least, immunization, the topic. Immunization is the best process to refrain our body from diseases like tetanus, tuberculosis, diphtheria, measles, chickenpox, typhoid, German measles, rubella, in other words mumps. These waterborne and airborne diseases are very harmful. So, immunization is a process which can be artificially administered, maybe through vaccines. The process then comes to the mind, what is vaccine? Vaccines are prepared in the laboratory. The same polio virus, tetanus virus, measles virus, those can be killed and saved, preserved in laboratories to be injected to our body, and those will be named as killed vaccine. If the viruses are made senseless, inactive, but live, those vaccines will be known as live vaccines. Then what about toxide? 3 types of vaccines are there. What about toxides? The virus or pathogens which toxin will be destroyed and will be injected to the body, those will be known as toxides. In 3 forms, vaccines can be injected to our body to refrain our body or to enhance our preventive capacity from the mother's womb till 6 years. 0 to 6 years is the time span for immunization, and during which period infant mortality rate is more in Odisha, India, and internationally in many more developing and underdeveloped nations. To eradicate or to diminish that rate, we are practicing immunization. This is its importance. Both vaccines and toxoids are to be used through a proper plan. That is, before practicing, we must see the schedule vaccines. So, a particular vaccine is meant for a particular disease. Understand? So many vaccines are being developed by our scientists. First vaccine is tetanus toxoid. Previously, we have discussed about the toxoid, that means toxin portion of the pathogens have been destroyed. So, when injected to our body, in our blood, WBC, you must be knowing, red blood cells, lohita rakta kanika, WBC, shweta rakta kanika. The functioning of RBC, red blood cell, is to provide oxygen and food to each and every cell of our body. But WBC functions as the border security force of our body, protects the body from outer organisms, outer pathogens, that means viruses, bacteria. So many entry points are there in our body, through oral cavity, through ear hole, through eyes, even through urinary and anus. So, we have to clean our toilets. If any cuts and wounds will be there in our skin, also pathogens will enter, and those will be killed by our WBC. Artificially, when we take a vaccine into our body, that is a dead bacillus or inactive pathogen or toxoid, but WBC, the restrictive element in our blood, will surround around the pathogen. Shweta rakta kanika ta charipote gheri jibo to digest it, as it is phagocytic by nature. कोष भुक बोली कह जाए ओडिया रे ताको खाई की हजम कर देबे when they entry into the body the rate of the number of WBC will be multiplied to many numbers infinite numbers to kill the outer side. But if our body is diseased, weak, the number of WBC is less, then it is easy on the part of the germs to disease our body. So, prior to that vaccines are administered and TT, tetanus toxoid is the first vaccine which is injected to the mother from the prenatal stage at the 4th month in 3 doses. In 3 doses keeping 1 month interval. Why it is? It is because when we are delivering the baby, there is possibility of normal delivery or forceps delivery or breech delivery or caesarean delivery. Instrumental use is there by the medicos. Sometimes the head of the child becomes larger than the body size. So, they use forceps to pull the child out by the natural passage. If it is not possible, they put a cut at the lower abdomen and put the child out. So, accidentally wounds may be created at head region and thousands infinite numbers of tetanus viruses are in air which enters into the child immediately within seconds and fluids will be there and the child will die at birth. So, it is very pathetic bearing the child for 9 months and 10 days, the ultimate result will be 0. So, why not we take vaccines in a prior rate, prior time? After delivery till 4 to 6 weeks, it means 1.5 months, the natural immunity from mother will continue. So, the child takes time to accommodate with the outer environment. It helps, this natural immunity helps the child, but prior to that, that means at about 1.5 month old, we have to take BCG. BCG, the name of the vaccine which is meant for tuberculosis, TB, in short TB. Why it is named as BCG? Because Calmette and Guerin has invented that bacteria. So, Bacillus of Calmette and Guerin. The vaccine is invented by Calmette and Guerin, so it is named as BCG. It is to be given to the children at 1.5 month old. 1.5 ମାସର ଶିଶୁକୁ ଦିଆଯିବା ଉଚିତ. Next is DPT. DPT is a triple antigen, a vaccine which is meant for diphtheria, polio and tetanus. Tetanus we know, ଧନୁଷ ଟଙ୍କାର. ଶରୀର ପିଲାମାନଙ୍କର ଧନୁପରି ବଙ୍କା ହେଇଯାଏ. The skeletal bone we can lean towards, but we cannot. A circus, a magician can do that. But if there will be crampness of muscles and joints will be disorder, our body, the body of the children will be like this curve. So, it is named as tetanus dhanush tankara, and it is there is least chance of survival of the children. So, DPT is a triple antigen which is meant for diphtheria, Konthalati. Previously, I have discussed what it is. polio is known as infantile paralysis. ଶିଶୁ ପକ୍ଷାଘାତ ପିଲାମାନଙ୍କର mentally the process, the muscular pain will be there, stiffness will be there. So, blood circulation, nervous disorder will happen. So, there is every possibility. You must have seen polio patients, those bony structure will be there, crippled leg will be there, crippled hand will be there, they will be unable to perform their daily duties, even walking, taking food. What about learning and getting education? Forget it. Next come to the point, that vaccine DPT which is meant for 3 diseases is to be practiced exactly at 1.5 months old child in 3 doses, keeping 1 month duration. Then what is its timing? 1.5, 2.5 and 3.5. 3.5 वर्ष पिला को लास्ट डोजटा दिया जिबा उचित. नेक्स्ट कम टू OPV, oral polio vaccine. Again, polio is such a harmful disease to children that to avoid their crippledness, we can take this vaccine in 2 ways, intravenous and through orally. You must have seen our celebrity, number 1 celebrity Amitabh Bachchan is giving advertisements to the people to aware them. 2 drops of medicine, vaccine will cure our child lifelong. So, take it. Mothers, pretty old mothers, they will speak, healthy child was there in the family, they took it, injected, now she is suffering from fever. ଭଲ ପିଲାଟାକୁ ସୁସ୍ଥ ପିଲାଟାକୁ ଅସୁସ୍ଥ କରିଦେଲେ ନେଇକି ଟୀକା ଦେଇକି. But it is very important, ଟୀକା ଜନିତ ପ୍ରତିକ୍ରିୟା ସାମାନ୍ୟ, we have to bear it up. If we will avoid that, what a loss will be there if there will be no muscles in the leg of our children, no muscles in their hands. So, they will suffer from lifelong. A crippled child should not be there. It will be a headache for the parents, although they have given birth to it with much pain. So, next come to the point, measles, milimila. Measles is very common airborne disease. After summer, at the last part of summer, it arises, and when the face of the baby will be with red pimples, all will think that prickly heat, ghimiri heji. No, it will spread to all part of the body. Previously, the child must be suffering from cold, fever, etc., which is the incubation period of measles. It could be avoided if measles vaccine would be provided to the child at 9 months old. आमे 9 मासर शिशु को गोटे टीका दबानी किंतु we will suffer. You must be thinking 7 to 14 days. After that, they will have a bath and they will be cured. No, it is not. Internally, there will be disorder in lungs, bronchitis will be there. They will just suffer a lot internally, which is not visible to we common people. So, definitely we must take vaccines in time as advised by the physicians nearby. The physicians nearby, hospitals may be, dispensaries may be, health centers, whatever may be, we must have checked during our pregnancy or while delivering. Any doctor, they will advise to take vaccines in time. Next come to the vaccine TABC. T stands for typhoid. You must be thinking that typhoid is a fever. No, it is very dangerous. The entire alimentary canal, typhoid, the odia of typhoid is antrika jwara. Antra nali re there will be high temperature for a longer period. So, there it will be difficult on the part of the child to take food, to digest, to absorb, so that the body will be weaker and weaker day by day. So, from the very beginning we must take TABC vaccine, which stands for typhoid and cholera. Then what is about AB? The name of the virus of typhoid is paratyphoid A and paratyphoid B. So, it is named as typhoid ABC, and it should be taken at 18 months old, then that means 1 year and 6 months. The child must be of that age to sustain that vaccine. Let us come to booster dose of vaccines. What about that? In between 0 to 6 years, the children suffer from many more common diseases. Common diseases, not communicable diseases. Common diseases means cold, cough, fever, loose motion, vomition, constipation. These are by taking care, daily care in daily cleaning, feeding, preparing beds, with utmost care in giving frequently water drinking to the child, and additional use of medicines, we can cure these diseases. But the resistance power of the child will be poor. So, we have to be conscious that although we have immunized the child through the proper schedule, again we must boost the power of vaccines. The vaccine which boosts the power of vaccines is known as booster vaccine. So, how it is to be given to the children? Let us have DPT, a triple antigen, which is given thrice at 1.5 month, 2.5 month, and then 3.5 month age of the child. After 1 year of third dose, again DPT vaccine should be given, which boosts the power of the vaccine. That dose is known as booster dose. And again that should be given at 5 years age, which is the preschool age of the child. At preschool, the child is coming in contact with so many children. So, there must be preventive power of the child to refrain herself from those communicable diseases. Again, booster dose is also given to polio. Polio disease is so harmful that we must practice booster doses. Let us come to these are the targeted communicable diseases: tuberculosis, diphtheria, pertussis, poliomyelitis, measles, tetanus, hepatitis B and Japanese encephalitis. What is hepatitis B? Hepatitis B is a vaccine which refrain the children from jaundice. Jaundice is a waterborne disease, and also it affects the liver, which is the largest gland of our body. Bile duct is there. When bile will come out from liver, then there will be digestion. In newborn stage, just after delivery, two stages are there, percunate and neonate. At neonate stage, sometimes infantile jaundice is there. That means, the functioning of liver is not under the control of the body. So, bile fluid will mingle with the blood to make it yellow. So, the nails, urine, skin of the body all will be yellow and the parents will be panic, which is known as jaundice, that is infantile jaundice, and after 8 to 10 days that disappears. But patience should be given to the parents that it is very common in many children, but if it will linger, then it is harmful. So, we must take hepatitis B A vaccine to reduce the possibility of jaundice in children. Here is a picture of tuberculosis. The child is suffering from TB, where look at the picture, which is very skeletal, no muscle is there. It is diphtheria, where the neck region is visible and a white layer from the upper palate, lower palate, tongue, entire mouth cavity, which is composition of two jaws, three pairs of glands, salivary glands, to keep the mouth cavity moist, to keep the food wet, and the teeth helps in taking the food into our esophagus, but that is contaminated. Viral white layer is there, which is very painful, and it is difficult on the part of the children to swallow the food. There is no any element to take food into our stomach. It is only the esophagus which have peristaltic movement, just they will contract and then expand, then contract, then expand. So, the food enters into our stomach and it gets digested by the secretion of chemical liquid enzymes. If the food will not reach to the stomach, how it will be digested and assimilated into our body to make us active, energetic, and our body will be built? It is next to impossible. Next, it is pertussis. It is the other name of whooping cough. It is one type of cough. It makes the baby very weak. When starts, it continues till 2 to 5 minutes, and the entire face, neck, body of the child will reddens, and the child will vomit whatever she has taken as food, fluid, etc. So painful disease can be prevented by the process of immunization. Next, poliomyelitis. The child will be unable to walk if leg will be affected, cannot ride, cannot take food if the limbs will be affected. So, its other name is infantile paralysis, Sishu Pakhyagata. The grey matter of brain will be affected by that. So, we must be very cautious till 5 years age of the child. We must take polio as 7 vaccine. Polio is otherwise there will be question in your examination that among the vaccines in the immunization process which vaccine is orally adopted by the parents to the children. Your answer should be for polio, that is known as 7 tika, 7 vaccine, 2 drops to the child. And if there will be fever, it is good. Slightest elevation in temperature after taking the vaccine, it shows the positivity that the vaccine is given in a right manner. If the child is ill, is suffering from loose motion, is vomiting, is suffering from fever, then that time we must avoid to take polio vaccine, because the vaccine taken that will come out from our body through feces. So, it is useless to take. Although so many posters, so many advertisements are being provided to the people through audio visual aids, through daily newspaper with higher captions, still some illiterate mass is there who are not taking, for which our government is taking drastic measures at grassroots level to make them aware of through picturization. You must have seen many posters about the polio suffering child like this. Next, come to the next disease, which is measles. I have already described about that disease, which looks like prickly heat, gimmiripari, but it is very painful. The child cannot sleep, cannot take food, the mother cannot keep the child in a particular position, always the child must be crying. So, the mother cannot be engaged in any other household affairs. If the mother is working, it is just very painful how to take care of the child depending on others. Let us come to the next point, it is tetanus. Tetanus is a disease which starts from cow's head and ends at human body. You must be hearing cow dung is so holy, gobar bahut pavitra, but it is the birthplace of tetanus virus. The nail corners are the entry points. Any cut and wound, even the skin holes, lomokuppa, they can enter into our body. You must be hard about if there is a deep wound. Deep wound can be possible by a glass or by a nail. लुहा कंटा किंबा काच द्वारा गभीर क्षत शरीर सृष्टि होता है. There is every possibility of tetanus. So, although the child is vaccinated from the very beginning, from the uterus of the mother, still again the child should be given ATS, anti-tetanus serum, within 24 hours. If there will nowadays accidents are very often happens. If any wound, deep wound will be there, the doctor will ask, in between these 6 months have you taken any TT? That means that TT or ATS will be functional in our body till 6 months. After that, if any cut and wound will be there, again we have to take anti-tetanus serum ATS. Otherwise, the tetanus virus will penetrate into our body till the skeletal bone, merudandara hada pakhare jo spinal cord achi, who controls the basic structure of our brain, Sushumna Kanda, the voluntary processes and non-voluntary processes of our body, that will be infected by the virus. So, the stiffness of bones and muscles will be there. We cannot, if I do not want to have a knot, it cannot be. But in case of tetanus patients, their muscles, their joints will curve to reverse direction. They cannot come to, they cannot lean towards. So, nothing can be done. साधारण भाव में बात मारुची बोली कह जाए, बात मारे से पिला को बंचब, because no first aid can be provided to these children. If will be provided, it will be more harmful. ଯେତେବେଳେ ଫିଟ୍ସ ହେବ ପିଲାମାନଙ୍କୁ କହନ୍ତି ଯେ ତାକୁ message must be given to the child. It is very dangerous. The child is immediately to be shifted to the nearby hospital. Medical processes are there to diminish their pain. Otherwise, the stiffness will be aggravated. So, you must know the cause and effects of all the diseases, vaccines for all the diseases. A particular disease have particular vaccine and particular time plan. So, students, you must know more till your study is completed, about the vaccines, about the process of immunization, as it is very important and very productive and very useful in our lifespan. Next, thank you all. Students, thanks for your patient hearing. Still, you must be very conscious in taking pure diet, water, purified water, all the cooked foods should be in a covered condition. Always take warm foods. Advise your family members to take pure air, have very sportive nature, do exercises every day to develop your natural immunity. Although there is natural immunity in our body, still all the processes of immunization should be timely taken consulting with the doctor nearby. Never take the faulty step. Sometimes people cold is there, headache, stomach is there, but pregnant mothers should not take any medicine which will be very harmful to the child within. It is the cause of the mental disorders in children, weakness in children, deformed baths, and again it also helps doctor to do cesarean deliveries. The delivery will be easier, but the mother will suffer till end of her life. Doing any duty, there will be pain in her skeletal bones and lower abdomen. then how she can take care of her child whom she has given birth. So, my dear students, you must be very careful in knowing the diseases, communicable diseases, fatal diseases, common diseases and the vaccines which are practiced following a proper time plan, that is known as immunization schedule. Every mother is provided with the immunization schedule by the government doctors in nearby government hospitals. So, it is my advice to you people to go through the cause and pros of diseases, vaccines, immunization schedule to upkeep our health. Health means mental health and physical health both. Not that I am fit to look, so I am healthy. My mental health must be good to cope up with my family, my society, my educational field, my neighbors, my state, my nation, and also I must be a part of the growth and development in my family, which will be a good family for others. My dear students, your health is wealth. So, you must be a unit particle in maintaining health of your family. You must cooperate with your mother. You must cooperate with your family. Income, expenditure, balance between the two will be made in the family and a major amount will be invested towards health definitely, as it depends on the health of the family. Thank you all.